Bismillahirrahmanirrahim. I'm Dr. Hera Kiani, and the topic for today's practical is nasogastric tube, NG tube, also known as feeding tube. The requirements for this practical are a feeding syringe, NG tube, stethoscope, lignocaine gel, and a tape. Coming to the indications, the first indication is enteral feeding, which we do in comatose patient. The second is the gastric fluid aspiration for lab analysis purposes. Number 3 is the gastric lavage or the stomach wash, which we do in cases of poisoning. Number 4 is gastric decompression, and number 5 is administration of medicines. Coming to the contraindications, we do not insert a nasogastric tube when a patient has recent gastric, nasal or esophageal surgery, or has nasal obstruction due to some tumor or polyp, or has esophageal obstruction because of any stricture, achalasia, tumor or esophageal webs, or there are esophageal varices, or there is some coagulopathy. Now the complications of this procedure are nasal septal perforation, aspiration pneumonia, or mucosal damage which leads to bleeding. Now moving on to the procedure. Measure and mark the length of the tube to be inserted. Check nasal passage for any obstruction. Lubricate the NG tube at the marked end with the lignocaine gel. Elevate the head of patient and start passing the tube. When the tube reaches the throat, the patient starts to cough if he or she is conscious. Tell patient to take a sip of water or swallow his saliva. To check placement of tube, put the stent of the diaphragm on the epigastrium. Attach the feeding syringe to the nasal end of the tube. Push 60 ml of air in the tube. You will hear a gurgling sound which indicates that the tube is in the epigastrium. Now secure the nasal end with the tape. Bismillahirrahmanirrahim. This is the NG tube. This is its gastric end and this is the nasal end. This is the feeding syringe. It is up to 60 ml. Now approach the patient from his right side. Check for the patency of nostrils. Look if there is any obstruction, DNS or any polyp. If the nostril is open, start inserting the NG tube. The first step is to measure the length of the tube that is to be inserted. Bring the gastric end close to the nostrils, then near the ear lobule, and then to the Xiphi sternum. Now measure this, mark this length of the tube, and then lubricate this part of the tube with lignocaine gel. Once you have lubricated, start inserting it into the nostrils. If the patient is conscious, he or she will cough when the tube reaches the throat. Ask him to swallow his saliva or drink a sip of water. Now once you have reached the marked length, you have to check for the correct placement of this tube. For that you'll need your stethoscope and your feeding syringe. Place the diaphragm of the stethoscope on the abdomen, on one side of the abdomen. Attach the feeding syringe filled with air up to 60 ml to the nasal end of this NG tube. And then blow the 60 ml air. You will hear a gurgling sound of air if the placement is correct. Next, you have to secure this tube with the help of a tape to the nostrils. Thank you.